Our children get nothing. We worked all our lives since I was 14. I was an engineer and Shirley was a teacher.
Shirley and Roy have been together for 70 years. Last month they moved into this care home in Kent together.
This was the problem in finding a care home which would take 2 people. Not easy, but my son and his wife managed to find this one. It's expensive. The fees are about £3,000 a week, which is taking all our savings. Eventually, they will run out in about 3 months. Our bungalow's up for sale. That money will be spent here, £150,000 a year.
In England, only people with assets less than around £23,000 are eligible for financial help for their care. The rest have to find a way to pay. The government announced an independent commission to transform social care today. It will be led by the crossbench peer Louise Casey, known for her damning recent report on the institutional failings of the Met Police. The findings will inform plans for a new national care service, one of Labour's election manifesto pledges. This is a sector which is on its knees, with growing demand and staff shortages, a care crisis decades in the making.
I don't want them brought up in a country where the only way pensioners can get long-term care is by selling their home.
No government to date has got a clear grip on a working solution.
One of the biggest things we've got to get right in our public services is social care.
Social care.
Social care.
Social care.
Today, the government's message: it won't be a quick fix.
We've got to make the right long-term reform decisions so we don't end up back here year after year, winter crisis after winter crisis. And so by the end of this Parliament, I think people will see Britain in a better place than the Labour government found it when we came in.
But Baroness Casey's full report won't be published until 2028, so at least 3 years until significant reform.
We don't really have time. The sector is in quite a challenging state at the moment. This is too far ahead. We've got people who need care and attention now. We've got providers who are seriously looking at their books and thinking, are we going to be able to continue? So the challenge is now.
There are plans for care workers to take on extra duties like blood pressure checks that would reduce strain on the NHS, with less need for patients to go to clinics and surgeries. But that also means staff need to be trained and retained.
There's tighter restrictions that are coming into force that will mean it's not going to be so easy to recruit staff from overseas. The wages aren't high enough to attract local staff. The importance and sort of kudos on care jobs is not the same as it is for our health colleagues, so it just doesn't attract staff.
Cross-party talks over the future of social care will begin next month, but there's still little agreement on how to solve the crisis. The Conservatives today criticising Labour for imposing higher national insurance payments, its recent budget adding extra costs that need to be found by care homes. Many families say they need change desperately and quickly, else they, like the social care system itself, face being left without help, without cash, without solution.
Francis Reid reporting there. Well, earlier I spoke to the Liberal Democrat leader, Sir Ed Davey, and asked him what he'd do to solve the social care crisis.
Well, certainly have a cross-party commission. Liberal Democrats call for that. But I think we can expect a report much quicker than 3 years. We think in the Liberal Democrats it should report by the end of this year at the latest.
We've had inquiry after inquiry. Why can't the government send any civil servant, be it Louise Casey, whoever, and just read all these reports, look at the consensus and say, this is what you've got to do? What is there to look into anymore? There's a crisis.
I think, given all the reports we refer to, the Dilnot Commission, for example, I think this could be done within the year and get that cross-party consensus and then implement this. It is urgent. There is a crisis.
Implement what? I mean, if we talk, government's using this phrase, National Care Service, sounds very much like National Health Service, sounds like a penny or two on income tax to get this moving. Is there any way other than that to achieve this?
Well, first of all, the government has put up taxes hugely. I think there'll be money there, particularly when you look at two things. First of all, the costs of inaction. If we don't take action on social care, I'm afraid the long-term costs to our economy, to our society, to the health service will be much larger. And then there's the benefit that if we sort out social care, support family carers, it brings huge savings and efficiencies to the NHS.
You just seem to suggest the money is there.
Well,
where is the money for this?
If we don't act on social care, it's going to cost the NHS more, and we'd waste money if we just spend money on the NHS and not think about social care. That's where the money is. I think if you do this properly, and many of the previous reports have referred to this, you can unlock savings. People end up in hospital longer than they should. It's much more expensive to keep someone in hospital than in a care home. That's a saving. And without proper care, sometimes people end up going into hospital unnecessary, and indeed they come out of hospital and then go back into hospital. These are huge costs on the NHS.
And when you say sorting out care, give us 2 or 3 examples of what that actually means in practical terms.
Well, the first thing is there's huge unmet needs, both for elderly people and disabled people. And the major reason they're unmet is because there's not enough care workers. And that's because we've not valued care workers anywhere near enough. That's why the Liberal Democrats have argued for a special higher minimum wage. And there's another key thing that we have been arguing for in the Liberal Democrats, is that we need to look at families and support families better. Most of the caring actually in our society is done by families, relatives and friends looking after loved ones, and they don't get support. They're not really recognised in the system.
OK, you've laid that out. Timings-wise, government's talking about 2028. You say that's far too long, but the fact is, if they do it in 3 years' time, we're slap bang against a new general election. It ain't going to happen. We're talking 4 years minimum, aren't we, on this current strategy?
That's why Liberal Democrats are very worried about this long timescale. Much better to announce it early on. And I don't understand why they can't. They've got broad cross-party support and they've got a huge majority. What really puzzles me, I'll be really frank with you, Alex, the NHS is in crisis and you won't solve that unless you solve social care and care more broadly.